My name is Heun, I'm a consultant psychiatrist, and I'd like to continue our series, Mental Health Disorders Explained. Today I'd like to talk about agoraphobia, and it's an anxiety usually associated with panic disorder and panic symptoms. The anxiety is about places, situations where escape might be difficult, such as crowds, public spaces, traveling alone or visiting a marketplace, as the name agoraphobia comes from. There are different criteria in some places, such as DSM-5. Agoraphobia can be discussed and diagnosed independent of panic disorder. However, there was always a strong association with agoraphobia, which caused panic attacks, that some people say there is a diagnosis agoraphobia with and without panic attacks. The other thing is, if the panic disorder is not just in these special environments, there's a diagnosis independent from that, and one should discuss comorbidity. Usually it's not totally clear where it comes from. There are some links between agoraphobia and panic disorder. That's epidemiology coming to that, genetics and environmental predictors, and the treatment are very similar. The prevalence of agoraphobia is about 3 to 6%, depending on the studies. There are usually 3 times more women than men. There are some early appearances in the population, and in some people it's just later in the elderly appearance. This might have been relation to anxiety and experiences. So there's some genetic problems which might be relevant, and what you see usually when you don't know the genes itself, you look at the family association, and family, first degree relatives of patients have an increased prevalence of other anxiety disorders. So if you have panic disorder, your relative might have other anxiety disorders, which indicates that there might be some genetic association. Psychoanalytically, there is an assumption that there is an unconscious conflict, and which causes this anxiety. Learning theory indicates that there might be some fear related to previous avoidance of anxious situations. As I said, there are lots of comorbidity with other disorders, depression, other anxiety disorders, phobias, lots of alcohol and substance misuse sometimes from the patient to treat the problems. Other disorders might be relevant, generalized anxiety disorder, which doesn't come into panic, social phobias, other phobias, obsessive compulsive disorder, depression. There's even a diagnosis, anxiety and depressive disorder, where both symptoms are mixed, and none is much more than the other. But it's very common that within depression there's also some anxiety. So what's the treatment? It's usual antidepressants are given, SSRIs such as paroxetine, citalopram, and others. On the short term, one can give benzodiazepines, but they're quite addictive, and especially because they're helping very easily, people are quite relaxed, and then on this experience want more and more of this medication, and then really get addicted. The problem then is that when you then want to get off the medication, the benzodiazepines, people have A, withdrawal symptoms, and B, having the anxiety. So that's then a very tricky situation, and it needs an awful lot of work from the psychiatrist and the GP to convince the patient to stop medication, which they initially started to help. There's some CBT approaches, just mentioned flooding, where people are put in a split anxiety situation until the anxiety stops. So So they have to learn that anxiety always stops. There's other cognitive methods, looking at triggers and trying to avoid triggers. I hope this is this short video about agoraphobia is interesting and you can learn something and use it. If you want more of this type of information, please check our website, Global Psychiatry Archives, and have a nice day. And if you like this video, just like us or subscribe even. Okay, thanks a lot.